It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, we continue our program now. Ryan Vellinga is an orthopedic surgeon at Skagit Regional Health, Arlington Orthopedics and Sports Medicine. We're staying on the north end, and meniscus tears. They're getting a lot more technologically advanced and fixing those, aren't they?
They absolutely are, Tom. It's amazing what they're doing with meniscal tears and meniscal repairs.
All right, here's Dr. Ryan Vellinga and Shannon O'Kelly.
Dr. Vellinga, welcome to Health Talk. How are you?
I'm doing great. Thanks for having me on the show.
Thanks for joining us. You're an orthopedic surgeon. You're working at Skagit Regional Medical Center up in the Smoky Point, Arlington area. Just recently moved to the area?
Yeah, we did. I just completed my training down in Los Angeles, and I've just moved up here, bringing my wife home. This is where she grew up, and we're excited about the job and the opportunity up here.
Tell us about your practice.
So I'm an orthopedic surgeon specializing in sports medicine, which it's kind of a hard thing to totally understand, but it's really minimally invasive surgery, arthroscopic surgery of the shoulder, hip, knee, and ankle is what I do primarily.
Primary sports medicine with an emphasis in shoulder or knee. Do you have an area or joint that you particularly like?
I love shoulders more than everything, and from anything from young people with instability problems on up to people with arthritis and doing shoulder replacements. Shoulders, one of my favorite joints, but I also love complex knee surgery with the scope, ligament injuries, meniscus, cartilage, that kind of thing, and also got trained in doing hip scopes and ankle scopes. So.
Wow, so you have a fellowship training, and we've talked in the past about fellowship, so just so our listeners really appreciate your training, a fellowship is 1 year in specialized training, just doing scopes of the shoulder, knees, hips, etc. So maybe talk about the fellowship training.
Yeah, so fellowship training for me, once you complete your 5-year residency, you can go out and practice on your own, but some of us choose to take an extra year to really subspecialize in one area of orthopedics. And so for me, that was in sports medicine, arthroscopic surgery, and reconstructive surgery of the shoulder, hip, knee, and ankle down in Los Angeles, California.
Los Angeles, that's a big area.
Yes, it is.
Man, you must have seen a lot of different type of injuries and a lot of different opportunities to really learn then.
It was really great opportunity down there. I got to work with some really prestigious surgeons and a group down there who take care of athletes on the highest level, and just got to see a real great spread of pathology types and do all sorts of unique surgeries and really kind of hone in my skills in sports medicine there. It was great.
Okay, we're going to get into the topic today, and we're going to talk about meniscal tears and meniscal injuries. But let's set it up, a little anatomical education here for our listeners. Tell us about the knee joint. We know it's a hinge joint, it's complex, but maybe we can set it up for our listeners.
Yeah, the knee is, a vital part of our body, helps us move around in hopefully pain-free way. And at first glance, it does seem like a simple hinge joint. All it needs to do is bend and extend. But when you look at it more closely, it's a very complex joint. It's a very complex interplay of ligaments, cartilage, muscles, and the bones in the knee to allow you to walk, run, stand, do everything we need to do in a pain-free way. And when any of those things is disrupted, it can really be debilitating.
And one of the things that often becomes disrupted is these menisci or meniscus,
yes,
which are these bushings. Tell us about the meniscus.
Yep.
and how integral they are to mobility and movement of the joint and what they do.
So meniscus are these C-shaped structures, one on the inside, one on the outside of your knee, and they are a cartilage-like substance. It's actually called fibroelastic cartilage, and as the name suggests, they're a very elastic property in that they act as a shock absorber to the knee. They provide a lot of cushion and dissipate a lot of the force through the knee, so it's not going directly through just the cartilage that covers the end of the bones. And so they provide a little bit of stability, but their main function is shock absorption in the knee. And when they work well, it's beautiful. They work great. The knee just feels good. But when they get an injury to them, it can be very debilitating.
Let's talk about the mechanics of that injury. We hear it oftentimes in sports. They have a meniscal tear, they're going to have surgery. Let's talk about the mechanics of the injury, how it occurs, signs and symptoms, a little bit of pathology 101 now. We went from anatomy, now we're doing pathology. Isn't that fun?
Yes.
Yeah.
So the meniscus, since it is bearing a lot of the weight, 50% of your weight goes through the meniscus when your knee's extended, and when it's flexed, 85% of the weight transmission goes through that meniscus. So you can imagine in a flex position with so much weight going through it, any abnormal loading of that meniscus between the bones, particularly with a bent knee or any type of twisting mechanism added to that, can cause a tear or injury to the meniscus.
More with Dr. Vellinga and Shannon coming up next on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Ryan Vellinga and Shannon O'Kelly on Meniscus Tears.
Dr. Vellinga, again, thank you for joining us and taking time out of your day to join us on Health Talk. Health Talk, we're talking about meniscal tears. You just set it up nicely. The mechanism of the injury a lot of times is a plant or a cut and a twist. Slightly flexed knee with a rotation, and that's what causes that tear in those menisci.
Yeah, that's correct. And we often see it as well in combination with other injuries. You can have with an ACL tear in your knee, which is a similar mechanism. You frequently injure a meniscus as well. As we age and get older, sometimes it's not as traumatic an event, but a really flexed knee, even bending down quickly or falling, can cause a tear in the meniscus as well.
And if this happens, what is the patient usually going to describe? Because there's some particular symptoms with a meniscal tear, or what sometimes is called an internal derangement.
That's right. And if it's a really acute traumatic injury, they can have sudden onset severe pain diffusely throughout the knee or maybe just on one side of it. And that pain can be accompanied by swelling of the knee, stiffness, and those symptoms can even progress to the point that they're getting what we call mechanical symptoms, which is this locking, catching, painful popping, or even, just the knee getting in a stuck, locked position that's hard for them to get out of it.
Yeah, because when that meniscus tears, it actually interferes with the articulation of the joint, almost creates kind of a speed bump. And, when they rotate or move or flex, sometimes it locks or buckles. Sometimes patients will describe instability with weight bearing and twisting.
That's right. That's exactly right. And those symptoms are miserable for the patient.
Right.
And sometimes as we get older and it's just kind of a wear and tear, kind of slow degenerative tear of the meniscus, sometimes you don't get those mechanical symptoms. It can just be persistent pain or soreness on one side of the knee or the other.
The good news here is you have this specialized training with this scope, and you can go in and fix these or repair them. Let's talk about a meniscectomy versus a meniscal repair and how you determine that as a surgeon.
Yep. So our treatment options really depend on the type of tear, meaning the shape of it, and also the location of the tear, and the age of the patient and activities of the patient. So if a tear is in the right area near the periphery of the meniscus, that's where it has good blood supply and there is healing potential there. So if it is a tear in that location, that's something we want to get to quickly, stabilize that tear, and give the body a chance to heal that tear to give them the best functional outcome of that meniscus. Whereas if the tear is more on the inner aspect of the meniscus and goes to that inner edge where there's no blood supply, there's no healing potential of that meniscus. And the best treatment in that, if it's causing persistent symptoms, despite conservative measures, sometimes we need to go in there with the scope and use our arthroscopic instruments to just clean out the torn portion of the meniscus to take away those symptoms. And again, it just kind of depends on the symptoms, the type of tear, and the symptoms that you're having. And with a discussion with your surgeon, we can really determine what treatment option is the best for you.
It's interesting because as a surgeon, you need to go in there and look at that tear, and you're looking at preservation. So you're trying to minimize as much as you can to help protect and stabilize and preserve the knee joint with that bushing or that meniscus in there.
That's right. When we go in there and we do need to clean it up, we take out only as much as we need to preserve the function of the remaining meniscus, but get out the part that is causing the problem.
Dr. Vellinga, good stuff. Welcome to the Northwest, by the way. Thank you for joining us.
Thanks so much. It's awesome to be here.
Shannon, I've had torn meniscus. I bet you have too. A lot of people have these tears, and repairing them now is more advanced and quick to recover from than ever.
It absolutely is, Tom. And to repair it, remember you have to have the right blood supply. A meniscectomy or to take it out is because there's no blood supply to the meniscus. But either way, that physician or surgeon is going to try to preserve that knee joint.
All right. Thanks again to Dr. Vellinga, SkagitRegionalHealth.org to get more information. One more segment to go after this on Como.